This young doctor here has provided us graciously a great deal of his time this afternoon. Who was it that put it? Pretty much everything that health related goes through your mouth in some way, effectively.
That's true.
He's Dr. Brian Black. From what I have understood from multiple people, he's probably one of the best dentists in the area. We had to screen him through this young lady right here. She's like, I'm not going to let you have a crack dentist at your class. I was like, okay. So I actually thought he was just humoring one of his patients and a couple of other people and being here today. Turns out he's actually very much into this. I'm just going to turn it over to him and let him talk about this kind of cool site he just showed me. So, and then we'll change over and he'll do his presentation. Sir?
Great, thank you.
It's all yours.
Well, I really appreciate being here. I was very excited for the opportunity. While I'm talking, if you guys have any questions or any want to add anything, just feel free to shout it out or let me know. When you were talking about that, though, about preparing, that's something that's very, very close to me and very important in my lifestyle and my culture, is being able to prepare for my family. Because the very most important thing to me in my life is my family and my relationship to God. And so whenever I think of things that are going to compromise that, I'm very protective of that. And so I was just going to show you this quick website. This is actually my sister right here. And she's a big blogger. And she's it's called Prepared Housewives. It's a very neat website where it goes on. When you guys are talking about different things, it talks about disaster planning, emergency kits, prep for babies, survival kits, first aid, medicine. It also goes into, filtering water with one of them. And some different topics about canning, pressuring, filtering water, and it's a really user-friendly website. And I just thought I'd just show it to you real quickly because you're on that topic. And she actually lives in Humble, Texas, just around just down the way. Maybe one day, if you guys want to, I can have her come in, and she's more than happy to talk a little more about her website. But she kind of took it. In our church, I'm LDS, I'm Mormon, and so a lot of times in our church we have different callings and different things, and so one of the big things, a part of our church is preparing, and we're really big on having a 1-year food storage supply. And so my sister was asked to kind of help her congregation where she lives at to kind of prepare for natural disasters, and she kind of started with it, and then she just ran with it, and just developed this website, and it's just a really user-friendly, a fun place just to get ideas. They talk about recipes that you can actually do with your food storage. If you go to a lot of Mormons' houses or a lot of LDS people, they have like a room dedicated to food storage, and it's not uncommon. Just like you guys do. A lot of people look at it as a weird thing, but it's good to be around like-minded people that think, this is serious stuff. Yeah. Just like that other guy said, I was mentioning in his blog, that people buy life insurance, people have fire hydrants, fire extinguishers, people plan for emergencies. We just plan in a little different way. To add to it, I guess I should say. Well, like I said, I'm a local dentist. I love College Station. It's been a wonderful, wonderful place for me and for my family. There's a lot of tender memories here, and they continue to grow each and every year. And I think we live almost in a very nice bubble here. And I feel like compared to most of the world, we have a very, very wonderful community with how conservative and religious it is. I originally grew up in Hempstead, was just down the road. My dad is a dentist there, was there for 34 years. He was a dentist, and he actually just retired last year and sold his practice, and he works with me now a couple days a week just to stay busy, but it's harder to get him to come into work now. He's enjoying that freedom a little too much, and so he comes when he wants to, but he's super good guy, and it's a lot of fun. It's a lot of fun working with him. He and I were very close, and we had a great relationship growing up. And actually, one of my first experiences in the dental world was when I was in high school. I was on the basketball team, and we were doing basketball drills, and we were playing a scrimmage, and the ball went on the ground. I was jumping on the ground to get the ball, and this other kid and I were scrambling on the ground. And this other kid thought, the ball went out to the side, so the other kid was going to try to jump over both of us to get to the ball. When he was jumping over, at the same time my head was kind of coming up, and his shin hit the back of my head, and my head face planted into that wood floor. And so I broke all 3 of my front teeth out, and I had to have root canals and crowns. But at the moment, I picked up my teeth, and I was like, oh my gosh, what do I do? So I went to my dad's office. It's still 5 o'clock, and I was just barely there, and I knocked on the back door and walked in and had my teeth in my hand, and he wasn't too thrilled about it. I just got my braces off. I thought he was done with me, and he was not too thrilled with that. So after graduating from high school, as I was mentioning, I'm LDS, and so I went on a 2-year mission to Argentina, and that was a real eye-opener living there for a couple of years. And I learned a lot of things about being self-reliant, self-sufficient. I think a lot of times in the youth today are so reliant on their parents, and they're not leading home. They're just kind of sticking, just sucking off their parents. Whereas this basically, we go for about a month and a half to what's called an MTC, a Mission Training Center, where they kind of give us a crash course, like, hey, this is how you say hello, hola, this is say baño, bathroom. They kind of give you a little crash course, and they say, on your way. And you go down there, and you basically have to learn the language while you're there. You learn to talk to the people. You learn their customs and everything. But it was a real neat experience to where I can learn this, is that I wanted to be able to survive in any situation I'm put in. One thing I did learn there, though, is they have phenomenal meat. They know how to cook barbecue. Asado is what they call them. They were just phenomenal. So I loved learning the meat. I love learning Spanish as well. It's come in a huge benefit learning Spanish. When I was in high school, my Spanish teacher sat me down and says, "You will never learn Spanish. I'm just going to pass you because I'm tired of dealing with you. You're never going to learn Spanish." But I guess I just had to live somewhere for 2 years, and I was forced to learn it. So I know it now. So then when I got back from Argentina, I was 21 at the time, and so that's the time I had to decide what I wanted to do. And so I'd always enjoyed my dad's lifestyle as far as he was able to be his own boss. He was able to take off, when times he wanted to. And he had a good income to where we could, do fun family trips. And yet he was still home and has a good family-friendly career. And so I decided to go into dentistry. So I went to A&M, and I decided to major in Spanish. Since I had been there for 2 years, I thought, well, I'm going to put this to work. And I graduated from the College of Liberal Arts at Texas A&M. And when I went to dental school, I was the only dental student that graduated from the College of Liberal Arts to go to dental school. All the other ones were biology or chemistry or something else, but I was the only one with the College of Liberal Arts. While at A&M, I met my wife, which is she was also going to Blinn at the time, and she was working at Wings of More, just on Deacon in Texas. So she put me through the rest. She stopped college at the time just because it was very difficult. She had a lot of health issues with endometriosis at the time, and so we stopped. She stopped school. Had some numerous procedures she had to have done, and then but put me through both the rest of college and through dental school. And then so since she had endometriosis, the doctor, when we were talking to him, he says, if you're going to have kids, you got to get started pretty quick. So from almost to the year of our anniversary when we got married, we had our first daughter, Madison, and she's a spunky little girl. She's so sweet. She's a little angel in our lives, and she keeps things exciting. She's always dressing up. She gives me a lot of attitude. She puts me in my place real quick. But unfortunately, she's not my only kid. She has brothers, and so. All the time with brothers, things can't happen. So, these are the two that make her day pretty tough. And this is my son Jackson, and this is my son Cameron. We are very big hunters and fishermen, and so I got my boy a compound bow a while back, and he's a pretty good shot, but he's still learning how to do it and everything. But if you look at his hair right here, if you see it's kind of longer on the sides and it's bald on the top, and he has kind of like a beard. He had an old man contest at his school, and so he wanted to shave the top of his head and leave the sides long and grow like a beard. So he had won it that day. This is the day he had went to the school and he had won that competition. And so he was sitting on our back porch here where he were, cutting. We just wanted to buzz off the rest of his hair. So he was sitting there, and all of a sudden this group of sparrows kind of flew in, and he says, "Dad, look at that!" He just said, "Hold on," because I was cutting his hair. He says, "Hold on." So he runs out and grabs his bow and his arrow, and he comes out. I thought, there's no way he's going to hit that thing. And so I just kind of watched. I thought, well, it's good. He's got to learn to miss. He's going to miss a lot in life and everything. And, you got to take the goods with the bads. But anyways, he hit it. He got that little bird. And a rule in our family, though, is if you kill something, you eat it. So we plucked it, we skinned it, we grilled it silent, we cooked it up. He said the best tasting meat he's ever had. But I think it was and he shot it, but he ate that up. And so these are a couple more pictures of them. That's his first dove he shot, so he's learning to shoot at 22 real well. He's worked on his open sights, and so he's a pretty good shot there. Now this first little rabbit he shot, so he's excited about that. Cameron this is my Cameron. He's never learned how to smile quite right. His muscles didn't work right when he's smiling. But one time I came home from work and they had all these deer hung up, or all these animals hung up, they said they had killed him, they hung it up, they're getting ready to skin him. So they had him all ready to go. And then he's my little runner, and he loves to fish as well. And also he's my smart one. So we went to, at Texas A&M, they had a phenomenal engineering career day where you could go down and they show all the neat, basically like a science projects for master and PhD students, which is phenomenal, the things that they have up there. So this is like a glass piece right here, makes it look like his head's chopped off. So. But like you said, my main objective today, as we can see on here, is to help just talk a little bit about the oral cavity, what it is that affects our teeth, how we can better prepare. Like the second one says, it's better prepare and prevent than it is to repair. And I think it goes right along with what you guys are trying to accomplish in your lives and understand. I think that unfortunately, there's a lot of things that, because of our society, as far as the foods we eat and how we treat our bodies, that the diseases in our mouth have become very rampant. And I think that it wasn't nearly as bad years ago. They say that right now, cavities is the world's oldest, most widespread disease. But that's to an extent. Before refined sugars came along, people did not have the dental problems that they have now. And so when I talk today, I'm going to be trying to talk about ways that we can kind of prevent cavities from starting. Because once a cavity gets started, there's not a lot that you can really do without modern equipment. And that's just the same way when somebody gets cancer or something like that. There's not a lot you can do about that to treat that without modern technology. But if we can find ways to prevent that, that is what we want to be able to try to do, is prevent the disease from starting and safeguarding our mouth. So when I first, I just want to talk about what causes cavities and what's going on in your mouth. So it says dental cavities result when the demineralization rate is faster than remineralization, and there is net mineral loss. So that's a fancy way of saying that every time we eat something, the sugar, the acidity, whatever we're eating kind of breaks down the tooth. Then when we stop eating, your teeth try to build themselves back up. And so every day, all day, your body's going through this fluctuation of when you eat, the cavity, the demineralization eats away at the tooth a little bit. Then when you stop eating, it starts rebuilding back up as fast as it can. The problem is when you let it demineralize too much. When you're just eating too much cavities, or too much cavities is sitting on your teeth, or too much acidic foods or sugary foods is sitting on your teeth for too long. I think the biggest, and this is my personal opinion on this, I think the biggest issue that has caused rampant decay are drinks. I think that if the sugary drinks are just rotting people's teeth at their jobs, at schools, at everywhere. And these little cubes, you can't really see them real well, these are cubes of sugar, how much is in each one of these drinks. A lot of parents will come in and say, oh, my kid's an athlete, he needs to be able to rehydrate and drink, and which I agree, but they'll give him a Gatorade and just have him drink on it all day. And so what's going on is your pH of your mouth needs to be around 6 or 7, it needs to be closer to 7 is where you want it to be at, just like about water is. Every time you take a drink, that pH plummets down. And they talk about, Coke has the acidity of almost battery acid. It is very, very detrimental. So it drops it way down. Now, I'm not going to say you can't drink Cokes, you can't drink drinks. But the problem is when it drops down, it's got to come back up. And so a lot of people, they'll go to, they'll eat lunch and they'll get a big bottle, a 64 ounce of Coke, and then they'll drink a little bit, and they'll take it to work. And throughout that whole day, they're just sipping on that. And that pH level is just plummeting extremely low. And that's just an acidic environment for those teeth to just be eating that all day long. Now, if you just go to a meal and you're going to be maybe once a day or once a week, or whatever, you're having a meal and you want to have a Coke or something like that, that's fine, because when you're eating, it's getting all mixed up, and then when you're done, just rinse your mouth out, your water, and you're good. You're getting that pH back to where it is. It's more when you're just sipping all day. And that's why it says sip all day, get dental decay. It's the rhyme they taught us in school. So don't sip on those drinks all day long. It's okay for your kids to have it, but just be aware of that. The other big thing I see that happened to me with my kids is fruit snacks, like sugary, with refined sugars. My daughter Madison, she loved those things growing up, or when she was really young. And we didn't think much about it. We'd give it to her, she'd ask me to give her 4 or 5 a day, and we weren't realizing that stuff was just, this is when I was in dental school, so I hadn't learned yet, so, but it was basically just sticking on her teeth and staying there. And as she tried to get it off, as the day went on, as soon as it started getting off, we'd give her another pack of those things, and we'd get on her teeth again. So she ended up getting quite a few cavities on her back teeth. Now, after learning that, with our other two boys that are younger, we don't allow that. They can have a treat. Obviously, we give them treats and everything like that, but it's at a designated time, or it's, at the end of the day, and we know to rinse their mouth out afterwards, or and then be sure and brush their teeth. They just don't have it excessively throughout the whole day. As far as the detection of decay, so one thing I want to help you guys understand is at home you can do some detection of it, which is very important to do. You look in your mouth, you see what's going on. A lot of times you can see darkness developing in the pits of those teeth. Your teeth have natural deep grooves throughout your mouth, and those deep grooves just grab onto stuff. And even if you brush your teeth, it's hard to get that stuff out of there. So that's why I would really refrain from sticky, gummy foods like that. When I was in Guatemala we went to Guatemala for about a week with my parents and for a dental mission trip. And when we were there, we visited a group. We go help the kids that were there to try to help educate on dental infections and help take out some bad teeth or try to repair as best we could. The kids in the city, their teeth were just horrific. They were just horrible. They were just rotting out just left and right. We would go to the country, and their kids had the strongest teeth in the world, not even a sign of decay. And the reason it was that in the city, they'd get those dang little treats that were just extremely acidic, and they'd suck on them all day long and rot the teeth. In the country, the kids didn't have that luxury, and so they ate the fruits, they ate the vegetables, they ate the healthy things, and their teeth were just phenomenal. And so, anyways, so one detection of it is visually looking. So you can look in and kind of see if something's turning dark. Sometimes you look in and it looks really good, and you can't see anything going on. So unfortunately, in those situations, sometimes we do take dental x-rays to be able to visually see if anything is developing in between your teeth. I tell my patients all the time, I says, your tongue is constantly cleaning the back side of your teeth, and your lips are cleaning the front side of your teeth. But nothing is ever cleaning in between your teeth. And so you only need to floss the teeth you want to keep, is what they always say, because the only thing that's going to get in between your teeth to clean out that crud is floss. And so if you're not flossing regularly, this can happen. Now, will it happen every time? No. Some people have a very good, well-controlled diet. They don't have a lot of high sugar intake, where they're not prone to cavities in between your teeth. But if you're drinking sodas regularly, or eating, sugary foods, the chances of decay in between your teeth spike dramatically. So you want to make sure you're flossing in between your teeth. And like I said, as I go along here, my goal is to talk about prevention of these problems. Once it gets to this point, there's not much that can be done outside of actually getting an actual procedure, getting it cleaned out. On early tooth decay, you're not going to have any symptoms generally. Every once in a while, I get a patient that says, it's really sensitive here, it's really sensitive, and sure enough, they have a cavity. But that's more rare. By the time your cavity is hurting you, you've kind of reached a point of no return. You've waited too long to get anything taken care of it. And so when it's an early tooth decay, that's when we can numb up and you can get that cleaned out, sealed up, and it shouldn't be a problem with you. But if you wait for that nerve, or that cavity to hit that nerve, the nerve is a very, very sterile environment. And when that cavity gets into there, it deteriorates the nerve tissue here, and it eventually causes it to die, and you'll get an abscess down there and get pulpitis. And so we'll talk a little bit more about that, but this is the point when usually patients will come in and they'll say, my tooth really hurts, I think I have a cavity. Yeah, you have a cavity, but it's already to your nerve, and so you got a lot more going on than just a cavity on that tooth. So if you have, a lot of times, and on this spot right here, I was going to show you one more thing. A lot of times patients will come in also and they'll have a tooth that has a hole in it and says, I was just eating a piece of bread and it broke. What a cavity will do, this picture doesn't show it very well, but it'll make a small hole, and then it actually grows the whole tooth, and it undermines that whole shell. And then all of a sudden they'll just eat something real soft, and they'll just break that shell, and that's why you end up with a big hole in your tooth, and it just eats that out. Now if that happens, obviously, sometimes it can be very sensitive, and very, very uncomfortable, so you want to be able to clean that area, rinse it with warm water, try to clean out the food as best you can, use dental floss. You'll want to take pain relievers for pain, or place temporary filling materials in the hole if necessary. And then, like I said, unfortunately, if it gets to your nerve, you're kind of getting to the point now where you're going to either have to take the tooth out or look at doing a root canal or something along those lines. But our goal here is to prevent us from even getting close to that stage in there. Okay, so on the broken tooth, I was going to talk to a little bit about that. Now, there are some teeth that when you're, if it's from cavities, a broken tooth, like I talked about, if it get decayed and it breaks, that's you just talk what we talked about before, where you have to get it cleaned out or get something done about it. Now, if you get a blunt trauma, there's 3 ways you can break a tooth. One is it just gets into the dentin or enamel, or it's just kind of like a little chip in the front. A lot of times that may be sensitive to hot and cold. It may not give you any problems. There's not technically there's not anything you have to do about that unless you want it fixed cosmetically. But as far as the health of the tooth, as long as the nerve is not exposed, it'll be fine. And even the sensitivity over time would eventually go away. But a lot of people just don't want it cosmetically, or it bothers them. It may be sharp or something like that. You can get something over the counter, just kind of a little paste stuff to just kind of put it there. And this is also something if you have a crown that came off, a lot of times you can put that in there and put it back on to help hold it in there temporarily to make sure that everything's okay with it. Going back to, if it goes into the nerve, that's where if you break it, you'll see like a little red pink thing in your tooth. And that red the alarm should be going off. That's the sterile environment. You still want to quickly put a temporary filling over that, and sometimes you can bond over that and stay stable without having to do a root canal. But generally, when the tooth is exposed, especially on older patients, if the nerve is exposed to the outer environment, then it gets contaminated and you have to have more work done. For a kid, though, a lot of times with kids you can put that temporary material on and you can patch that and not have to do a root canal or do anything more invasive than that. This is again that picture showing that once the nerve is exposed, it gets inflamed and it starts hurting really, really bad. And then all of a sudden it'll go away. And sometimes the patient will think, yeah, it hurt like 3 or 4 months ago, but it went away. And so what's happening is, as the cavity is getting to the nerve, and the nerve all of a sudden gets really, really irritated. It's dying. It's undergoing irreversible pulpitis is what it's called, and then it dies. And then it's like, okay, great, it doesn't hurt anymore. The tooth's dead, so I should be okay. But generally, after about 6 months or so, this tooth fills up with bacteria. That nerve, where there used to be a clean environment, it'll fill up with bacteria, and then you get an abscess down there. And then, like we talked about with an abscess, you generally got to get that tooth out. As far as home ways to get it out, I don't know a really easy way to get it out. I was thinking about showing that video Castaway where the guy takes the ice cream and pushes it out. Yeah, I don't know of real ways. I was glancing through this book when they were talking about When There's No Dentist. I really like this book. I hadn't seen it before, but I was going through pretty quickly, touching on each chapter. And this is almost a crash course guide to what I do as a dentist. If you can do the stuff in here, you can take care of it. I mean, it talks about anesthetizing areas, the different type of forceps you'd want to have on hand if you were going to do something like that. This is a very well written book from what I could see so far.
Free download also.
Oh yeah, so I like this book. I would look into it. I think I might get it for my
I'll
house.
put it in the Dropbox.
Yes.
What
Where there is no dentist. I mean, because it talked about when you have an abscess like that, and I would get with your general doctor and maybe talk to him about possibly having a round of antibiotics you can keep in your first aid kit. I have one in mine. I think it's important to have, because if this were to flare up, it's going to swell up really bad, and you can't do anything when it's swollen like that. You can put an ice pack on it, and you can kind of calm it down a little bit with pain relievers. But that antibiotics is more good for it, calming it down than anything. And a lot of times when patients come in and the face is swollen, I have to put them on antibiotics for 48 hours before I can even do anything. So if you have a round of antibiotics for tooth pain, it's going to help calm that down to where after 48 hours you can actually do something if you wanted to try to attempt something on your own, and you're in that situation. But like I said, this book showed the forceps you would use. It would show kind of where you put the anesthesia at for a lower tooth versus an upper tooth. Yes, sir.
Excuse me, what antibiotics specifically did you
Oh, I'm glad
recommend?
you mentioned that. So I love amoxicillin if you're not allergic to penicillin. It's the best antibiotic to have for the mouth, in my opinion, is amoxicillin. And that's the same thing that I noticed. I checked in their book what they suggest, and they suggest the same thing, amoxicillin. Obviously, if you're allergic to penicillin, do not take that. That causes a bad reaction. When patients are allergic to penicillin, I give them clindamycin or a Z-Pak sometimes. And so those are also really good ones on there.
There's something for that. I know amoxicillin you can actually purchase at like PetSmart. It's a fish antibiotic that you use for I'm sorry?
Fishmonks.
I did not know that.
It actually says amoxicillin on
same-
the package.
made the
Does it
same-
really? Yeah.
And it's even the same dosage you would probably give what,
500 milligrams 3 times a day.
Okay, so they're in 250 milligram caplets, so
3 times a day?
Would you be able to get that at producers?
Most
I
veterinary
don't know,
places.
but you might be able to, I will look into it. Because I imagine it is a cattle antibiotic as well. I'll look into it.
Most of the cattle stuff's gonna be injectables too.
Yeah, so that's one of the biggest things is that I think having the antibiotics help out with that initial pain to where you can actually get it treated or get something done about it. So that's one trauma. So if a tooth breaks into the nerve, the last one is if it breaks so bad it goes down into the bone, where the tooth just cracks right in half. And that's just
That does hurt.
and that's just you just get it out. There's not much you can do about it.
How much, just to give us some substance here, to pull that tooth, I mean, how much force is necessary? Is it just a little?
You know,
Or is it-
when I was last thinking this book, they made a good observation. I try to explain to patients. A lot of patients, you'll see those YouTube video clips of people getting floss and they'll tie it to a rocket on their kid and they'll shoot the rocket off to pull the baby tooth out. It's not a jerky motion that gets the tooth out. They talk about when you get a stake in the ground, you pull that stake back and forth, back and forth, back and forth. There's basically there's a ligament that goes around the tooth right here, and that ligament's like a trampoline. And so when I go to take out a tooth, I'm going to use this little instrument. It's called a luxator. It has it in that book where it talks about you kind of elevate, and basically you're just kind of tilting the tooth back and forth like this, just kind of rotating, rotating, rotating. And as you're doing that, it's slowly breaking the fibers going down here. And once those fibers are loose, then you just get a little, some forceps, you just kind of get it, you just kind of rock it back and forth, and it'll come right out. And this tooth, a lot of times, this side would just, when you're doing that luxating, it would just roll out, and this side would just kind of roll out that side, that way. Yeah.
So, with your experience on pulling those, and of course you know how, we would not, but I'm looking at that right there and I'm thinking, you get a hold of that thing and it breaks off about halfway down. You got a big problem then.
Yeah, that's a very good point. That's the issue I see with taking out teeth. If you're not sure, if you haven't done a lot, know exactly where it's at. Then make sure you got it all out. But in this book, like I said, I was looking at that. They even talk about if a root breaks off right here, there are little instruments you got to go in there and dig out. That's when it gets really tough. I hate it. It's a bad day when I'm taking out a tooth and it breaks down here. It ruins my day, basically, because I got to get in there and mess with it. Yes, ma'am.
When I came to you, I had a situation like this to where my tooth hurt for a couple of days and then it just went away. And I didn't think anything about it. And then when I was using a water pick, that half of the tooth that you saw missing came right out.
So what happened in, you don't
So
mind,
did-
you
so
don't mind if I
did-
talk about your case, do you?
You know, no,
Okay.
I don't mind.
Okay, so in Miss Thurman, she came and she had a tooth that was...
There it
You're a documented case.
I know, it was right before the tooth fairy.
Exactly. They have this little picture in our office on our refrigerator. It says, "This is why dentists are so rich." And the dentist is sitting on top of a pile of teeth. You know, that for the tooth fairy. But Miss Thurman, when she came in, she had been complaining, like she said that her tooth had been hurting for a while, and then it
Went away.
It went away, and then it broke. What had happened is she had a crack into her dentin. And into her, when you get a crack into the dentin, sometimes the whole tooth doesn't just crack right off. It's cracked, but it's still together enough. So every time you chewed or if you did something that kind of aggravated or stimulated it, it would hurt a little bit. And then, now when it went away, sometimes the tooth will kind of get a little bit better, but it's basically broken all the way through and it's just about to break off. Now yours, fortunately, sheared off in a way, kind of like down this way. It wasn't not your front tooth, more that one in the back. But it broke off in a way to where it didn't get into the nerve and it didn't go down to the bone, so I did not have to take it out. We did not have to do a root canal, so we're able to just put a crown on that tooth to hold it all together and reinforce it.
Well, did the root just dissolve?
No, the root's still there. So if you look at this tooth right here, so yours would have broken. Yours broke just that little piece right there.
Yeah.
So you still had your root and everything. So when we restored it, we just put a cap right over the top of it. So I trimmed a little bit on the front, and then we just put a cap right over the top of it. And I think my next slide is actually on the crown. So what you did, yours broke a little piece off like that. So we trimmed the whole tooth down, and then put a porcelain cap on top of it, just like that. So that's what we have to do on there. And so, like we were talking about with preventions and things to do to watch out for, because the last thing you want to do is, if everything went to pot, and you're in a scenario where there's some work you should have had done, or you have some very large fillings or teeth that are questionable that are going to give you problems, more than likely, over time they will. And so when patients come in with very large fillings like this, I warn them, I say, that tooth is more than likely going to break on you in the number of years. When? I don't know. Most of the time, like Ms. Thurman was saying, you have sensitivity to hot and cold, it's maybe a little sore to chew on. You start getting some telltale signs that, hey, something's not quite right here. And that's giving you a sign that the tooth is cracking real bad. But every day you drink water, as you eat, as you breathe, everything, your tooth is constantly expanding and contracting, expanding and contracting. They say they does that hundreds of times per day. And as it does that, the filling is also expanding, contracting, Unfortunately, they don't do it at the same level. And so as they expand and contract differently, small cracks are developing and small spaces are developing to where they'll eventually form a crack line where they break. And so I tell patients, I said, these type of cases, this one I would say, we usually take a picture and say, this has a high risk of breaking. I recommend you're looking at getting a crown at some point to protect that tooth. Because once that crown's on there, it makes it stronger than it's ever been besides a virgin tooth. It's extremely strong. But these right here, these are moderate. These are ones, a filling can be strong up to about 50% of a tooth. If the filling is larger than 50% of the tooth, then you start running the risk of it breaking or cracking or things like that. So you just got to watch out. This is basically acting like a big wedge down the middle of that tooth. And it's not adding any strength. It's just acting like a wedge sitting there. It's going to cause it to eventually crack. If a tooth ends up missing, obviously there's things that can be done about it. You can do implants. You can do bridges. Implants are phenomenal. If you the thing about if you lose a tooth is the only thing keeping the bone in your jaw is your tooth. If you lose that tooth, your bone starts to resorb away and go away, and then it gets very weak in this area right here that can be more prone to fracturing and different things like that. So if you're missing a tooth in your dentition, it's best to get it restored if you can. It's not necessary. Sometimes it can affect your occlusion down the road or things like that. But I have thousands of patients that have missing teeth throughout their mouth, and they're just fine. But this is a solution to missing a tooth. That's kind of what it looks like at the end when they put that little implant on. It's a little metal stud, and you put that on top of it.
So it literally has the ridges like it indicates in that left picture there?
It's a screw. It's a screw.
It's a screw?
It's a titanium screw.
Okay, so that is illustrated there below the enamel of the teeth, outside the teeth, the dotted stuff. That is bone in your jaw.
This right here.
Is that your jawbone?
That's jawbone, correct. So this pink is your gums,
Okay.
and everything down here would be below your
Okay.
in your bone.
So these teeth are in sockets in your jawbone. Okay.
Correct. So where you lost a tooth at, you would put that implant down in that spot to kind of
So
preserve
it just
that bone.
stabilizes the system.
And you stabilize the system.
Does your body ever reject the implant?
Very, very, very rarely, but it can. They have about a 98% success rate.
Okay.
But more often, it's not because the body rejected it. It might be that it got loaded too soon, or there might have been some infection in there when you put it in there. But titanium is very biocompatible. Now, having said that, anything you research, you're going to find controversy with it. And so you have to make a decision on your own. Is it worth it to have this in my mouth, the titanium? I was glancing through this book, and they talk about advantages of implants versus the disadvantages of it. And one of the disadvantages they talk about, it's titanium. It's not your natural body. It's a foreign object. And so that could be something that, if you're worried about that is something that you want to think about. As well as...
Metal detectors at the airport?
Yeah, exactly. As well as root canals. In the book they talk about, a root canal is technically a dead tooth when you're done. It's shown to have done well and they do well, but there are research out there that people are very adamant that it causes other problems. So you have to kind of research it yourself and decide how you feel about it, what you feel best about in these areas. So.
And I was sitting there thinking to go get some stainless steel screws at Lowe's.
That's right.
That'd be cheaper and I'd get a whole box of them.
That's right, exactly. Speaking of that, my dad...
Just get some short ones for the boats,
That's right. My dad, when he was in Hempstead, back then, when he was practicing 30 years ago, the next closest dentist was close to Houston, and so one time a guy from a rancher came and said, my horse has a really bad abscess tooth. I gotta get this taken care of. What can I do? Can you please come work on it for me? And he says, well, I guess if you sedate the horse, I'll try. So he went to Lowe's or to the hardware store and got screws. Because when we do a root canal, we basically had these really small files, like a little bit wider. I mean, you blew them up, they look like screws. So we got different sizes of screws and went in there and just, we each one screwed them out, got all the nerve and bad tissue out. And
Oh,
pulled it
but
up,
the
so-
screw was what he used as a
File.
file or a drill or
Yeah,
whatever.
exactly, to go in there and clean it out with. So he's
Man, where was YouTube when you needed it?
That's right, exactly.
Awesome.
Man, what a deal.
That would have been awesome to see.
That would have been.
Yeah,
I don't know if you don't wanna see your dentist working on a horse.
Man, think about it. He can do that.
I know,
What
I'm
could
more
he not
confident
do?
in it.
Right? No, right? What could he not
He
do?
can do anything.
Because he just made that stuff up on the fly.
Yeah.
Now, what's dangerous is when your vet's coming towards your house. That makes you nervous.
I have several vet students or vet patients that work at the school, and it's interesting learning how close it is. We actually learn from veterinarians better tools to take teeth out. They were better at getting teeth out because the horse's roots are like this long. So humans' teeth are only about that long, so a lot of times we're just using blunt force to try to get those things out, whereas the veterinarian would have to use finesse and these little instruments to go around and cut that ligament and work it out to get it out. And so we developed a lot of the instruments from veterinarians on that. So,
What?
but yeah,
Interesting.
A bigger version of much bigger
exactly.
version.
Exactly. So, okay, so this is where we talk, and I was trying to put the handout kind of going along with what we were talking about. So you talked about broken tooth, toothache, restored gums, and that we're down to permanent teeth knocked out. If you knock out a permanent tooth, you can technically take that tooth and put it right back in. The thing you got to look though is to make sure the root's not broken. If you look at this picture, you got to make sure it's all the way to the end and it looks good. But if that tooth pops out, you take that tooth and you pop it right back in as fast as you can. Maybe if they got into some dirt, rinse it off a little bit. Put that thing right back in as fast as you can.
That's gonna hurt like crazy.
When I knocked my teeth out, these two knocked straight off, and this one got pushed real far back. And so I ran, when I went to my dad's, he immediately, before even numbing me up, he pulled that front tooth back into the spot it's supposed to be at, and then he numbed me up to take care of those other two. Your body is in such shock, and there's so much adrenaline. I don't think that it hurt that bad. Once it.
Plus your lips are probably swollen up like somebody hit you in the face
Yeah,
with a
exactly.
four or something.
That's right. My dad did after I did that, and I had wasted all that money on braces. But,
Oh, it's gonna work.
yeah. In school, they actually showed a case where a patient came in and they brought the teeth and they got it in a really timely manner. And I think it was the mom was calling on the phone either on the way to the school, and it was a kid. Her son had got him knocked out, and he was probably 10 or 11, and so they were his permanent teeth. And so he says, "Put them back in, because they'll take it. They put them back in." So she's like, "Okay." So she put them back in, and they came back, and there's two front ones. She put them in the wrong hole. But they took, and they just did some cosmetic work later on, and they fixed it. But it was just kind of funny. It just looked like they were kind of going out to the side. Like,
Get your shoes on the wrong feet.
Why don't you put 'em in backwards?
Yeah, I was thinking backwards, yeah.
Couldn't you just
Yeah.
pop them right back?
At least they weren't backwards, right? Oh no! By the time it'd been long enough to where they felt they took them out and switched them around, it'd be too much trauma and wouldn't have taken it. So on baby teeth now. Now baby teeth are different. If a baby tooth falls out from trauma or falls out, leave it out. Don't try to mess with it. You don't want to mess with the adult teeth. One thing I saw in this book that I liked, it talked about the flow chart of when kids should be losing their teeth and their adult teeth coming in, which I think is helpful to know whether you should, whether it is an adult tooth or a baby tooth, or if this tooth should be being lost right now. I had a patient that came in on just this past week, and she came in and says, "My son, he lost his tooth. I'm so worried. What should we do? I can see the roots of it still. He lost his tooth." I said, "Well, come in. We'll take a look at it." Open up his mouth. And all it was is the baby tooth had resorbed away and fallen out, and it was just the adult tooth poking through, is all it was. And so it wasn't a real emergency, but it was just something that, if you know what's supposed to be happening, you can be better prepared for it. So on baby teeth, now when they get trauma, my daughter, Madison, she probably, when her brother probably pushed her down the stairs. I don't know how it happened, but she ended up face first on the bottom of the stairs, and her teeth are bleeding just like this. This isn't her mouth, they're bleeding just like this. But there's nothing to do. Sometimes they get pushed back, don't try to pull them forward, just let them be. Sometimes they'll drift back forward on their own, which is good, but if they don't, it's not that big a deal. The thing you want to watch out for is as the tooth starts turning dark. I mean, these pictures didn't turn out too good, I apologize. But this tooth is dark right here, and my daughter, her tooth turned dark, and she called it her green tooth. It looked green, and so she'd always have a little green tooth there. And even that's not bad if it turns dark. What to watch out for is if you get like a little pimple right up here. That's an abscess. If it gets a pimple up there, you want to get on some antibiotics and then get that tooth out. And this is one where it'd be relatively easy to get out of it on those baby teeth generally. On the front teeth. Baby teeth in the back are real difficult to get out because they look like cow horns in the back. They grab onto that bone real bad. So that's about baby teeth. And like I said, it's good to know the flow chart of them, which is in the book that I brought here. Mouth trauma. Most of the time, mouth trauma is caused. Most of the time, sores in the mouth are caused by trauma. You're biting your cheek, or you're getting hit, or something like that, and they usually heal within 10 to 14 days. Most of the time, there's not anything to be too concerned about that. During the time, rinse with warm salt water, or gel can help with temporary relief. When I put this right here, be sure your vitamin levels and body are correct. I get some patients, particularly older patients, they'll come in and say, my mouth really burns, and my tongue will burn sometimes, and I have, it's called burning mouth syndrome. Most of the time, it's because their vitamin levels are off. You got to make sure, so I take a multivitamin. Vitamin B, it really helps out a lot with that, and sometimes getting that vitamin back in the correct balance takes care of that issue for mouth trauma there. Here's just kind of a picture of one. On these right here, you can get, these will eventually go away after 10 to 14 days. I put Debactyl on it. I don't know if you've ever heard Debactyl. I'm trying to think of, it slipped my mind what it actually, the generic name of it or what it is, because it's not, you're basically cauterizing the wound to where it doesn't hurt. It's on the little package of the Debactyl, it has a flame on it, because when you put it on, it stings really bad for about 5 seconds. But you have to put it on for 5 seconds, it stings really bad. Yes, ma'am.
Can you spell that?
Debactyl is Debacterol. Debactyl, I think that's right.
One more time.
Let me see
Is
if I
that-
Use it in a sentence.
Exactly.
Is that an over the counter? That's over the counter.
That's not over the counter, but I'm trying to think what it is because it's nitrite,
Silver nitrate?
silver nitrate. I think silver nitrate I think is what it is or something.
Really?
I'll look it up.
Because it will, I know, and I used it when I had, I guess ingrown toenails as a kid,
Mhm.
and the doc used that it basically just kills the skin, and the skin of course regrows, but
Right.
it can't get infected if it's dead, essentially.
Yeah.
Is that what it would
I want to
be?
say it is. I'll look it up on the little sheet that I have at my office.
Says you can go on eBay.
I'm gonna
Can
look
you
on
find out? Is
Amazon.
that selling it on eBay? Can you find it on eBay? Yeah, you can buy. I would have that in your emergency kit.
There you
Does
go.
it have flames on it?
Let me see which one you have found there.
Flames on the advertisement?
Oh.
That's the kit, the packaging he
Yeah,
said.
the Debactyl canker sore medication. Yes, I like that stuff a lot.
So what other products do you,
Really, that's
home
it.
remedy stuff that you might?
And that's a good question. The only one I have on hand is that I use is Debactyl, and besides that,
Canker rid.
yeah, exactly. You can do. They have
Yeah.
over the counter
It sells,
stuff.
silver nitrate, 10 gram glass bottle, high purity.
Yeah,
That's right, like one of the next bottles next to it.
yeah, that's it. It has a little flame on the side. That's it. Yeah, so if you get some of that, that's wonderful stuff. I have some of that at my house, and when I get it with my kids, because otherwise you keep banging the thing, and it keeps getting sore, and you bite it, and it
Keep
hurts,
biting it
and
again.
it gets
You said
worse.
it's not over the counter?
Well, you got it on eBay. You
It's
got it
on
on eBay,
Amazon.
right? So I
It's on
guess
Amazon too? Okay.
Okay, so silver nitrate, is silver nitrate what Debactyl is?
Yes.
correct.
That's what it seems like.
That's what it
It
seems
is
like.
silver.
I have to make sure that's what I think is the same thing there.
For what it's worth, for little sores and whether you get a little, like if you eat spicy stuff, you get the little pimple thing on your tongue or on your cheek or something. I don't know, it may sound crazy, and you're not supposed to put it in your mouth, but I use camphophenique.
Okay.
Put it on a swab and just stick it on there, and it burns like the for a
There's
while.
something called ambisol too.
Okay, that's
Ambisol,
Ambisol
yeah.
actually
Ambisol,
numbs
okay.
it too.
but
Yep.
Kanka is really good.
Yeah.
Kanka, like canker sores, but Kanka. And you can buy that anywhere locally. But that stuff, it's actually, I think it's it's like Ambisol for the gums, and it's literally gummy. So when you put it on, like just all you need is a drop. Like say on that, just one little bitty drop, and it has an applicator just like Ambisol or like you said, Campo for Neat. And it's a gummy paste, and it won't get all in your mouth like Ambisol. No, Ambisol will make your whole mouth numb.
Yeah.
But the Kanka will dry on the one spot,
Oh,
so it won't get all over your mouth. Make your tongue numb and everything else.
Way back then.
Kanka is good stuff. That's in my mercy.
And he did
Okay.
not. But that's
K-A-M.
good policy.
K-A-N-K-A.
Oh, N-K.
Stab it, and it,
Probably burn like
pretty
Dixie,
much.
yeah, exactly, clean it out real good too, I bet.
I guess you could probably use it for anything. I mean, that's a gummy substance, and it's a local anesthetic, I guess. Is what
So on
doctors say.
the,
What it would be.
so going past that to the broken jaw, next one is, a somewhat common one, it's not real common, the broken jaw. And there's accidents versus what I consider neglect. Now, accidents, they just happen, and unfortunately when an accident happens, there's not much you can do except for get the treatment done necessary. This is a kid I had. He was playing baseball and he got hit with a baseball bat in his jaw.
Ooh.
And he came in, he's like, oh man, my tooth kind of hurts down here. It's a little swollen. My bite feels a little funny. It just doesn't feel quite right. And so we took a PA of it. And I said, well, let's take a panoramic view just to check to see what's going on. If there's something major going on. And sure enough, that jaw had cracked right up through the top of there. And this part of the jaw was dislocated from that part of the jaw. Now, I assume when this happened, way back when, before we had the procedure we do now, it would heal. It just, you wouldn't bite correctly ever. It would, your jaw would be to the side and just, it would look really awkward. So, but beyond actually getting it fixed correctly, I mean, when I was younger, my dad got in a car accident and he got hit sideways, his jaw got broken, and they had to wire his mouth shut for about 8 weeks with braces. He had to get braces in, they wired it shut, it had to be immobilized, everything was, pureed when he ate it. So that's unfortunately what you have to do. But as far as immediately what you want to do is you want to, we'll go in a minute, we'll talk about it in a second. Send for the oral surgeons. I says, you're above my pay grade, bro. You gotta go somewhere else. So we just send right down there. But they got him in immediately. The oral surgeons here, the Brazos Valley oral surgeons, they are really, really good. They're a good group of guys, and they work very hard, and they do phenomenal work over there.
What do they do with this? Do they cut him open and pin it or something? Or?
So when he's done, a lot of times they'll have to kind of reset that jaw back, and they'll have like little brackets. You know those little metal brackets you can get these Lowe's? They have the different hole screws in it. So they'll have one of those right there. With like,
So what we're figuring out is Lowe's is a great
exactly. That's where we go when we're things are tight for our medical supplies.
Quick, run down there.
They got stainless
So
steel.
but they'll use titanium ones, really high grade ones. They'll go in there and they'll put a little hole there and a little hole there. The issue you run into is when that breaks, if you see this line that comes down through here, and that little hole, I used to have a dark hole right there, but that's your nerve. Your nerve gets cut. Now, there's nothing wrong with that happening, except you just won't have you won't be able to feel half your lip there.
And you'll be
So
biting that
his-
jaw.
So this part of the kid's face is numb, basically.
Now, it doesn't happen every time. That can be a side effect. A lot of times it doesn't get numb. Like, they're really good to where they can avoid it, but sometimes with the swelling and different things like that, it just happens. There's nothing they can do about it.
Don't the nerves regrow themselves every 7 years?
No, they don't. Nerves do not regrow. That's the only thing in the body that unfortunately does not regrow very well. It's one of those things that when you're born with your nerves, they rarely grow anymore throughout the rest of your life. There's very, very little growth.
Oh, accident I had one time, I lost feeling in a couple of fingers, but I feel them now. That's why the question of, does
Do
it
they regrow?
reconnect or does it?
They can. Now, sometimes it may take like 6 months or a year, and they'll slowly come back. When my dad was working on a piece of wood at home, he was using a little table saw trying to cut a little piece. And he put that piece of saw in there, the wood in there, and the saw caught that piece of wood, flipped it around, and cut all 3 of his fingers off, like right off the sides and up the sides there to where it cut him in half.
Oh.
And so my dad knew that if he's going to try to get these reconnected or get these fixed, if those nerves are going to get reconnected, they got it. The sooner you get them put back together, the more likely you're going to be able to get filling it back in those. It won't happen overnight, but it will happen sometimes over time. And sometimes your body compensates where it feels like you have filling, but it's not quite the same. But it's almost like your body almost compensates for it.
They call it phantom pain.
Yeah.
You'll feel a damaged limb that's not there anymore.
Right. So it was kind of funny on that when my dad got his fingers cut off. We lived in Hempstead, so at the time he had to drive an hour to College Station or an hour to Houston to get something taken care of. So my 17-year-old sister was at home and he says, come with me. So he took her down, and she's a wimp. She gets very lightheaded, but he made her numb him up, and he would talk her through how to sew him up. And so she sewed up all his fingers, bandaged it all together. Then they went down to the emergency room, and the doctor looked at it and says, looks good. There's nothing we're going to do about it.
Check it off on this station.
Yeah, so but all three of the fingers, he has feeling in them again. He can move them all normally. The only thing that looks funny is his fingernail on the one finger looks really weird, but other than that, it's all back to normal. So it's good you're learning about this kind of stuff. You know, I'd be really neat to see the first aid kit that they're going to be doing in January. I think this would be a real neat one. They talk about how to handle immediate procedures, because I'm surprised at how many people. I don't know if I want this on YouTube, sometimes or video or Facebook, when they come, like I'll have some neighbors or some friends that they'll cut their finger real bad and they'll want me to come over. They'll come over, you know, and just I'll just sew them up for them. And it's a real easy procedure to do. Just knowing how to do it, knowing what you're doing, and, you know, and just knowing your limits as well on what you, because you never know what situation you're going to be in. You want to have betadine on hand, really kill the infection before you sew that up.
When our kids were little, they told them if you cut your finger off to soak it in milk.
I don't know about milk. I know with teeth, you want to do that with teeth. It helps kind of keep it in a good solution. So I guess milk. I guess, you know, your human tissue would be the same thing. I don't know for sure, but I know teeth. If you're, like for example, if you broke a tooth that came out, and you didn't want to put it in yourself, you put it in milk and bring it and have dentistry put it in there. We tell them to put it in milk.
Good to know.
So this is what a normal jaw looks like. You can kind of see how solid it is through there. It's a very durable part of your body, and it's got to take a lot of force. I mean, you're chewing on it all day long. It gets a lot of blunt trauma from it. What happens? We talked about earlier. When you lose your teeth, your bones start deteriorating, and they deteriorate not fast, but relatively quickly throughout your life. As
You mean your jawbone deteriorates?
so it'll look like that.
Oh.
So you see how much thinner it got right there? And this is actually not, I've seen some where it almost doesn't look like they have a jawbone anymore. And that, if you lose all your teeth and you don't replace them, you will lose all your bone eventually. Now some people it's a lot less rapid, and some people it's a lot quicker. It's just every person's a little different on that. Yes, ma'am.
Why is that?
The bone, they don't know exactly why. Exactly. They don't know exactly why, but the teeth stimulate the bone,
Oh,
and they
okay.
keep it there. They keep the structures there. It's just kind of something that, you know, they have to have both of them.
Symbiosis there, yeah. Yeah. Question. So, you know, I'm assuming it's when we were young, it wasn't unusual, and not really that unusual now for people to have false teeth.
Mm-hmm.
So people with false teeth, their jawbones are just wasting away.
Yes. Have you ever gone to those convenience stores and see those pictures of the old people? They had the real puffy lips, and you know they look real funny on the pictures. Those are patients without jawbones. They don't have their dentures in, and if they bite down, their teeth aren't together anymore. Your relationship between your nose and your chin get increasingly closer because that space is you're having to close more to touch your two jawbones, and so the space becomes closer. Your chin gets closer to your nose, and that's why they kind of show that in those pictures.
Oh.
But if you have implants, that won't happen?
Correct. That's actually my next slide. Were you going to ask me something?
It was dentures. That
Oh,
was
okay.
mine, yeah.
So that's why I was talking. Oh, where did it go? Oh, there. I guess one of my slides got deleted. I had a picture of a case where when a person got their teeth out, they have 4 implants that they put all across there to kind of help keep that bone in place. And it's called All on 4. You probably heard commercials about it, or Clear Choice, like teeth in a day type deal, where they'll take all the teeth out and they'll put 4 implants. And this is the patient that had, you know, this was his teeth right here, and then they put new dentures in. They had the 4 implants underneath of it, but I don't know. I apologize. I don't know what happened to my picture. I had one.
What's that bottom left picture? What's going on there?
All that's just this is all his gums. So basically just gums touching teeth. Basically.
Oh, so the photo right above it is him with his lips, and the bottom photo is
just pull that exactly.
Oh, gross.
Yeah.
What, that all inflamed, or what?
It is really inflamed. And but whenever your teeth get a lot of bacteria around them and plaque and build up, your body mounts an immune response because they know that plaque and calculus is not supposed to be there, and they're trying to eat it off. And so they send a lot of the inflammatory cells there, and the gums get inflamed, they get really red, and that's why if you have periodontal disease or if you have plaque and you brush your teeth, your gums will bleed a lot. And that usually means that there's some infection going around there. Now, 99% of the people have normal gingivitis, so I wouldn't be too worried if you brush your teeth and get a little bleeding. It's not that big a deal. Just kind of clean that area more carefully. But if your gums are real red and every time you even touch your gums barely, they're just bleeding like crazy, that's a sign that you have periodontal disease on there, and you need to get that cleaned off. Again, they talk about some different instruments. You have to basically take a real sharp little instrument and scrape that off the teeth. And you can see it's like black around it, and the breath is usually really, really bad.
Is it a bacteria or what is it?
It is bacteria. It's calculus, and then the bacteria all lodged inside the calculus. The calculus grabs onto the tooth like a rock. It's very, very firm.
What are you, you calculus, what is that?
Calcium deposit.
Oh, you're saying calcium, okay.
Calculus is what we call it in the dental. Calculus is what we call it in the dental world, but it's calcium deposits.
Okay, and that's like at the base of your teeth?
You can get all it looks like a ring around your tooth, and it basically the first stage is to get your gums really, really red, really, really inflamed, and they start bleeding real easily. Then it starts moving down, and it starts eating your bone away, and so eventually somebody with really bad periodontal disease or calculus, they'll eat the tooth right out of the jaw.
So it's going down the root of the tooth.
Correct.
The longer it's not
Nothing's
taken
done about
off.
it. Well, I had a patient one time that came in, he was an oil worker, and those guys, I swear, never brush their teeth out down the rig sometimes. But he came in and he's like, I think my teeth are bad. And I looked at it and I pulled his gums back. He literally, the only thing holding his teeth in place were the calculus rings holding onto each other. So I told him when I said we're gonna have to do dentures. When I take an impression, it's probably gonna pull some of your teeth out. So when I did the impression, sure enough, I pulled out that impression. I had about 5 of his teeth in my impression, and then just because there's nothing holding it anymore on there when it gets that bad.
So he had to have
That's right.
So his had gone so far, it was past the point of doing anything about it. It was
Correct.
already-
He had to go just straight to dentures.
Oh my.
Yeah. And so that's when I would highly recommend if able to put those implants in there, because he was only like 30 years old. I felt real bad for the guy. I mean, he just didn't ever take care of him. I don't think he ever picked up a toothbrush, and so now that he's by the time he's 40 or 50, he's going to have almost no jaw unless he gets implants or something like that. On the jaw, I mean, restore support to the jaw if possible or necessary with implants. Now, like I said, some people have extremely strong bones and they don't have to do it. It's not as crucial. They just have really thick, dense bone. Most of the time, it's males. Most of the females, they get real thin and deteriorate pretty quickly. If you're noticing that you have a possible jaw, you want to just have a broken jaw, to see if the teeth close correctly, if it's like swinging to one side or you're not touching on one side, there's a good chance. If you have swelling or muscle spasms, apply a cold claw press, and if you want to stabilize the jaw, if you think it's broken, you stabilize it with a handkerchief around the head or a tie, something to kind of stabilize it, put an ice pack on it, and then get you the oral surgeons or emergency room to have them take a look at it.
What would cause your teeth not to fit together right?
When it's broken, if you look at this
Broken jaw.
picture right here, when the jaw's broken, if you see these teeth are touching, but because this jaw broke, it broke down a little bit, and so this side isn't touching anymore. So when he's closing, only one side's touching there.
Okay. Because my teeth never fit. They were always one side or the other. And one day I was walking my dog and I fell on the street and hit there. And I went to the dentist not long after, and my teeth fit perfectly.
You're a walking miracle. That's good. You broke your jaw the right way. You saved yourself from having to break your jaw and fix it up.
Shake his head.
So that's very fortunate.
Call the Pope. I saw it in my pancake.
So on the handout, like I said, they have the different things on there that we kind of went through today. I don't know if there's any other questions you might have or any other things you wanted to ask me.
One thing I think of is what sort of things you may have 2 or 3 or so that you might say, if this happens, just go get some help. Don't try to do anything with it. You know what I mean? You mentioned one a minute ago. You break your jaw, and you know you're out of alignment.
Right.
Hold it in place and go get some help.
That's the thing about dentistry, is that it depends on how bad a situation we're talking about. I mean, if you're like in those books where there's nothing existing, you're gonna have to figure it out. I mean, they figured it out 200 years ago before dentists came along, so you're gonna have to figure something out. But if it's something that you're trying to just, cut corners on, to do stuff with, honestly, if a tooth's broken, I don't think I really mess with trying to pull that out on your own unless you're in a dire circumstance and you have to do that. If a tooth's aching, that's usually a warning sign that there's something more serious is going on with a bad nerve or an infection that's in the jaw. Even though antibiotics might calm it down and make it go away for a couple weeks or a few weeks, it will probably come back. So I would get that addressed. So it's kind of
This time, I'm going back to that jaw thing,
Right.
If that ever did occur. So the sort of the mental picture here is, if you feel like it's kind of close, just kind of hold it in place.
right, exactly. And just put like a towel around or a handkerchief, and just kind of hold it there.
Yeah.
Are you talking about if you're just gonna do it yourself? You mean?
No. If you just you're just where you're out somewhere and you got to get to town or whatever.
Yeah.
So if it's out of alignment, you feel that it is. If you can still get to town, you still leave it alone, or do you try to kind of push it into place?
I would try pushing it into place. I would kind of stabilize it where it felt comfortable. I'm not because
where it doesn't get worse.
Yeah, right, exactly. And stabilize so it doesn't kind of bounce up and down. So you push it up as best you can to where it's comfortable. Put a handkerchief or a towel around it and just hold it there.
Okay.
When you were talking about that, though, it made me think of on the jaw. One thing I do see that happens every once in a while. It's not real common, but if you see this little hinge right here, this is and this other little depression. This is where your socket of your joint sits. This is your temporomandibular joint, and every time it opens, it slides in this joint. Every once in a while, this joint will slide and it'll pop out past there, and your jaw is stuck open like this, and it's stuck open. Technically, I've had a few patients show up and their mouth's open, they can't close their mouth basically. Well, what we do is we're taking the jaw, we're coming from behind the patient, and we kind of get their jaw, and we're pushing it down and sliding it back into this spot there. So that is something that, if you're out stuck somewhere, you want to probably be able to do that it's usually they're yawning really loud, really wide, and all of a sudden they can't close their jaw. It's not from trauma. That is something I think would be beneficial for you to know. And you put your thumbs on their teeth, and then you put your fingers underneath their jaw, and you kind of push down, and you kind of push down and forward, and then rotate back.
So you're just putting it back in place.
You're just putting it back in place. And then I'll take some ibuprofen after that.
That just randomly happens?
Yeah, some people it's just real loose,
like a
that
shoulder
jaw.
joint.
It's not very common.
How does TMJ play into all of this, like with the jaw and trauma and stuff like that?
So you have a disc right here with a joint, and you have muscles that attach to it. And so every once in a while that gets really inflamed, and it just hurts and it's sore, and your muscles attach down to here, and they go up to your temple, and they go to the back of your neck, and they can cause severe headaches. Sometimes you have a joint right here that sometimes the joint will get in front of this little disc, the disc will get in front of the joint, so that when you're opening your jaw, that disc is sliding forward, and then your jaw slides forward, and then it pops back into place. That's that popping noise you hear when it pops. And that, if it's not hurting you, a lot of times we'll say don't mess with it. But if it becomes symptomatic, that's when you want to try like a night guard to try to help stabilize the jaw at night.
That's TMJ?
That can lead to TMJ. TMJ is temporomandibular joint. TMD is a temporomandibular disorder. So if it's hurting or you're having a problem with it, that's when it kind of gets in the realm of you're having a disorder or pain or something like that. And that would be caused from the joint there, the muscles, and it's quite a bit that goes into the TMJ. Yes, ma'am.
Because a couple of weeks ago, mine did start popping. It doesn't hurt, and I do wear a night guard. What do you do for it?
It does not hurt?
It doesn't hurt.
And
every
did it
time
go
I
away, or
eat-
did it just...
No, when I chew, it pops.
A lot of times, if it just barely started, I would say maybe try to use some soft foods for a while where you're not really putting a lot of pressure on that joint. If it's sore at all when you're touching it or anything like that, sometimes I'll say ibuprofen to help any inflammation that might be going on there.
It doesn't hurt, but it's just pop, every time I chew, it pop, 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 you know.
Really?
Yeah.
Wow.
And then if it's not hurting right now, I'd almost just leave it alone.
Okay.
I don't
Yeah,
think I
because
would
like I
go
said,
along
this
with
just
it.
started like a couple of weeks ago.
Yeah.
That'll be $25
You can pay when you leave. Any other questions for me about that? Just real quickly, the last thing I was going to talk about, when you're talking about getting prepared and getting things taken care of, like I said, it's very close to what I do with my family and what I do with my church and different things like that. And that goes back to me to the parable of the 10 virgins. I don't know how many of you are familiar with that, but that's a very touching parable that Jesus talked about when the 10 virgins went out to meet the bridegroom. And the bridegroom wasn't there, and they were tarrying, and it was taking a long time. And so the 5 wise ones had brought extra oil with them. They had extra oil with them waiting. The slothful ones, or the 5 unwise, the foolish ones, did not. And so they did not know when it was going to come. They did not know when it was going to happen. But then all of a sudden they heard the bridegroom's coming, the bridegroom's coming. So they all stood up. They started filling their lamps with oil. And the women, the 5 wise ones had it. They said they were ready. They were ready to go. And the 5 foolish ones says, "Give us some of your oil. Give us some of your oil." And they said, "No." He says, "You got it. Go back and buy some." And when I thought of that the first time, I thought, well, that's kind of selfish of them. Why did they share and stuff? But I really feel that the Lord in this parable is comparing the oil to our relationship with our Heavenly Father, with our faith. And if we can't share our faith, we can't share our relationship with our Heavenly Father. It's something we all have to nurture for ourselves, and that's something that they can't be shared with another person. And so that in this scenario, the wise women, the 5 wise women, had prepared themselves every day of their lives to meet with their Maker, to meet with their Heavenly Father. And the 5 foolish ones, they had just kind of lived life to the fullest. They just did what they wanted to do and did not think it was important to be ready at that time. I also think it relates very much to food storage and having that. I think it's important to be prepared to what's going on. I think there's a lot of analogies that we can make with this parable, and I think it's very fitting for what you guys do here, that how well you're preparing yourselves both physically, temporally, spiritually for what comes and what's coming in the future. I wish I knew what was going to happen, but we live in scary times. I feel that these are the ends of time that talked about in the Bible, and it'll be very interesting to see how it all plays out. We live in exciting times, but at the same time, very scary times. But I know that as we keep our faith with our Heavenly Father, that in the end, Heavenly Father takes care of His children, those that prepare. These are both His children, those 10 women. But the 5 that prepared are the ones that were taken care of, and I think that's wonderful how you guys prepare every day for that. But I appreciate you guys letting me come out here. It's been a lot of fun. Thank you so much.
All right.